Another new variant of COVID-19 detected in the UK.
New and highly contagious variants of the virus.
Brazil has the second highest coronavirus death toll in the world.
And over 6,000 cases in the last 24 hours, the highest daily cases in the country.
The president is investing in more vaccines. Already 1.9 million shots are being given each day.
South Africa studying one such mutation.
The country is struggling with a new variant of the virus and a devastating second wave.
Coronavirus disease 19, COVID-19, is a highly transmittable and pathogenic viral infection caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, which was first identified and emerged in Wuhan, China on December 2019 that led the first confirmed death on January 9, 2020. Coronavirus is an illness caused by a virus that can spread from person to person. COVID-19 is caused by a virus, not by bacteria. The virus that causes COVID-19 is in a family of viruses called Coronaviridae, in which it is best known as the second most frequent case of the common cold. Coronavirus is an infectious disease caused by a new strain of coronavirus, and many people will die if they get infected. The latest update on the coronavirus pandemic was more than 1,549 reported cases of concerning new coronavirus variants first spotted in the United Kingdom, South Africa, and Brazil that have been reported in the United States by the U.S. Centers for Disease Control and Prevention. New coronavirus variants could lead to a rapid rise in the numbers of COVID-19 cases. The vast majority of these cases are the more contagious variant, which was originally detected in the United Kingdom.
All viruses, including coronavirus, can change over time. This can lead to new strains of the virus with different characteristics. While there are many different tiny changes with the genetic sequence of the virus, there are three main variants that are circulating in the world quickly. These are the UK variant, otherwise known as B117, the South African variant, and the Brazilian variant. Although today I will only be discussing the UK variant and answer some frequent questions about it. So to begin with, the UK variant of coronavirus is called B117. It was first discovered in Kent in September 2020 and was linked to an increase in cases in the UK. This variant is now a dominant strain in the UK and has already spread in 70 countries around the world. Recent studies show that it's likely that the UK variant is linked to a higher chance of hospitalization in death than the original strain of the virus. More research is happening to understand the risk of this variant. It's also important to remember that the overall risk of death for each person who is infected is still low. So, proceeding with the frequently asked questions. First is the Pfizer and AstraZeneca vaccines effective against the UK variant? Early results from the lab studies shows that Pfizer-BioNTech vaccine offers a good level of protection against mutations found in the UK variant. While further research is ongoing, likely, the vaccine will still help protect against this strain. A study also in the Oxford AstraZeneca vaccine shows that it offers a good protection against the UK variant of coronavirus. This is a good news given this is the most common strain in the UK now. The study showed that this vaccine offers 75% effectiveness against the UK strain compared to 84% against the initial strain. This is well above the 50% minimum level of protection that is recommended by the World Health Organization. Next question is, where did it come from? It was first detected in September 2021 in a country in England, then took off a spread in November according to the World Health Organization. Next question, is it more deadly? Yes, it is possible. There is some evidence that the variant first found in the UK, carries a higher risk of death than the original strain, the British government's chief scientific advisor said in January. The verdict is still slightly out, but theoretically, yes, it's possible. Castellani, the infectious diseases specialist at South Area Hospital, told CBC News. And unfortunately, that's the way viruses work and the way mutations potentially catch up to us. Next question is, should we be wearing better masks? Yes, experts say we should consider finding different quality masks. Wearing 2 at a time or wearing them more often. The CDC released a new guidance on Wednesday that said a lab experiment had found 2 masks meant double protection. The CDC said a cloth mask worn over a surgical mask can tighten the gaps around the mask edges that can let virus particles in. The researchers found that wearing one mask, surgical or cloth, blocked around 40% of the particles coming in during an experiment. When a cloth mask were on top of a surgical mask, around 80% were blocked. And that's it for the UK variant. Always remember, wash your hands, always wear masks, and distance socially.
Coronavirus is fast evolving and many variants are arising. What do you think is happening? So let me present to you the new variant in South Africa. So what is the South Africa new variant? All viruses, including the one that causes COVID-19, constantly mutate into new versions or variants. These tiny genetic changes happen as the virus makes new copy of itself to spread and thrive. The South Africa variant found in Hamspire village. Most are inconsequential, and a few can even be harmful to the virus survival. But some variants can make the virus more infectious and threatening to the humans. There are now many thousands of variants of pandemic virus circulating, but experts are concerned about the South African variant, also known as 501.v2 or V.1.351. Is it more dangerous? There is no evidence that the South Africa variant causes more illness for the vast majority of people who become infected. As with the original version, the risk is highest for the people who are elderly or have significant underlying condition. But there are concerns. It can spread more readily and the vaccines may not work quite as well against it. Some of the changes involve the virus protein, the part that gains the virus entry into human cells. It is also the bit that vaccines are designed around, which is why experts are concerned about this particular mutation. South African variant carries a mutation called N501Y. It appears to make it more contagious and easy to spread. Another mutation called E484K could help the virus dodge a person's immune system and may affect how well coronavirus vaccines work. So do vaccines work against the South Africa variant? It is too soon to say for sure or by how much until more tests are completed. Although it is extremely unlikely the mutations would render the vaccines useless. Scientists have tested the Pfizer COVID vaccine against N501Y and E484K mutations in the laboratory using blood samples from vaccinated people. That study vaccination appeared to work but was slightly less effective. Early results from Moderna suggest its vaccine is still effective against the South Africa variant, although the immune response may not be strong or prolonged. 2 new coronavirus vaccines that could be approved soon, one from Novavax and another from Janssen, appear to offer some protection against the variant. Preliminary work suggests Oxford AstraZeneca's vaccines offers limited protection against mild disease from the South Africa variant, but the expert says it should still protect against the severe disease. Even in the worst case scenario, vaccine can be redesigned and tweaked to provide a better match in a matter of weeks
or months if necessary. So how far has it spread? It is already the dominant virus variant in the eastern and western Cape provinces of South Africa. At least 20 other countries, including Norway, Japan, and Austria, have also found cases. In the UK, 147 cases of the variants have been found, while extra testing in the areas of England affect. So what is United Kingdom doing about it? Travel is now banned from many countries in Southern Africa, as well as Tanzania and Democratic Republic of Congo. Targeted testing in the community is also taking place in some parts of England. Public health authorities and scientists are studying the variant, and we will share their findings soon.
The following are according to our research about the COVID-19 Brazilian variant. Brazil became the third country in the world to breach 10 million coronavirus cases, with infections picking up speed in recent weeks as a new variant spreads amid the shortage of the vaccines. While encouraging signs in the fight against the COVID-19 pandemic are emerging globally, Brazil is battling a resurgence of the virus, which has been made worse by year-end gatherings and new strain found in the northern city of Manaus. For most of this year, the country has reported over 50,000 new infections a day, about double the rate for October and November. Deaths have hovered above 1,000 a day. The severity of the crisis was on display in January as Manaus, nestled deep in the Amazon rainforest, declared a state of emergency and began to airlift patients to other states after the local healthcare system collapsed. The new wave was added to the strain on the public healthcare system after already suffering from decades of underinvestments, and led state governors to increase pressure on President Jair Bolsonaro's administration to aid hospitals and buy more vaccines. The country was expected to do better vaccinating than it did containing the disease. But the country was late to start, kicking off its campaign in mid-January with just 6 million shots on hand after approving formulations from Sinovac, Biotech, and AstraZeneca. Both have agreements to be locally produced, but manufacturing suffered delays as a key ingredient took longer than expected to arrive from China. A month later, 9 capitals including Rio de Janeiro have suspended immunizations after shots ran out. About 5.9 million doses had been administered, according to the state's data compiled by Bloomberg. The political infighting also plagued the vaccination drive, with Bolsonaro often bashing vaccines and initially refusing to buy Sinovac's booster because of its Chinese origin. Wellington Diaz, the governor of Paui, said, "We started 2021 in critical situation. The numbers showed just how big our failure was. Vaccinating is the only way." That's all for the Brazilian variant update.